Well, we've certainly been talking about it a lot lately, a spike in babies and children with severe cases of RSV, and that they are flooding hospitals and emergency rooms nationwide. Doctors saying they're seeing severe reactions in babies up to kids as 5 years old, with a lot of those patients needing to be put on breathing machines. So with all that, more pressure on drug makers, and they're trying to make an RSV vaccine, and they're turning that notch up to full. So let's get a better handle on that with our 9 Health expert, Dr. Payal Kholi. Pfizer especially is working on a vaccine right now that actually would not go to babies. It would go to pregnant moms.
That's right. It's kind of a big deal to study a vaccine or study anything actually in pregnant mothers, but they were intentionally picked because, you know, RSV is one of the leading causes of hospitalization and death in infants, especially under the age of 1. So the idea here was to vaccinate mom while she's pregnant, late in her pregnancy, have her make the antibodies, and then pass them on to the baby through the placenta. And it actually worked really well. So it prevented the risk of severe RSV infection by 82% in the first 3 months, and even 70% up to 6 months.
It is only a few months away, hopefully, right? If it all works.
I hope so, because the FDA actually called this, green-lighted this as a breakthrough therapy, because RSV is something we've been struggling with for decades. We had a trial earlier this year in older adults, which also showed very promising efficacy, up to 87%. So hopefully in the next few months, but definitely by this time next year, we should be seeing these vaccines out because they were safe and efficacious.
Yeah, it seems like, I mean, if you have a baby in the winter months, that's the first thing they warn you about is be careful about RSV. But this one was completely different this year, kicked in so early. And some would say, well, why haven't we had a vaccine before?
It's been a little tricky, actually. So the last time they studied an RSV vaccine was in 1966. And unfortunately, that vaccine actually led to a couple of babies dying and a bunch of them ending up in the hospital that got it. So that kind of lost the momentum on it. Yeah. And we sort of just gave up on it until recently. And now we've designed this new vaccine, which is a little different from the COVID vaccine, which was a messenger RNA or mRNA vaccine. This is a protein vaccine, and it's bivalent. So it has 2 different subtypes of RSV, A and B, and it's actually the part of the RSV that the hand that's used to grab the cells. That's basically what they're injecting into your body, so your body sees that hand, makes antibodies against it, and that way when the infection happens, you have those antibodies to neutralize.
We've had RSV before. Why is it so bad now? Is it partially related to COVID or to the way we live our lives now?
Very much so. So it's the perfect confluence of us taking off the masks, us having not really had a lot of respiratory infections in the last couple of years, and I think a shift in the virus. The fact that it's now coming on as early as the summer months, which we've never really seen before, and seeing these high levels here in October. But with this kind of a vaccine, and now they're actually working on an antibody therapy as well for kids, for babies, for prevention. We're looking at preventing millions of hospitalizations for babies and saving 100,000 to 120,000 lives.
Do you have a quick 1, 2, 3 for people before there's a vaccine, how to prevent or make sure that you don't get RSV?
I think you know what I'm going to say here. Wash your hands. Wear a mask in crowded indoor spaces, and cover that cough and stay home from work or school if you're sick. And you can't be too careful. Let's not get complacent. Complacency is not an option this season, especially with what we're seeing so early in the season.
All right. Thanks as always, Dr. Payal Kholi.